Well, good afternoon, everyone. It's nice to see you all. Hello.
Hello.
Good afternoon, everybody. It's nice to see you. Thanks for being here. First of all, I just want to say I am grateful to be in the company of a lot of advocates and providers, people who are on the ground working every day to help Oregonians have what they need when it comes to mental health and addiction services, people who are suffering, people who are in crisis. We got a lot of folks here today who have been working hard to keep Oregonians safe and healthy. And I just want to say thank you right off the bat. I also want to take a moment to speak directly to Oregonians who are struggling with substance abuse, a mental health challenge, or in a lot of cases, both. I want Oregonians to know that your state, my office, wants to help. We are here. We are trying to make sense of how we can best help you, no matter where you live, no matter what you can afford. And we want to make sure that those services are going to be there for you to receive help. We are working on that every single day. As your governor, I am fighting for a behavioral health system that really does support healing and recovery across our state. And I also want to say to the families and friends of folks who have been watching a loved one who is suffering or tragically may have died because they didn't get the help they needed, I just want you to know that we see you. I recognize the pain that you have been through, and also am inspired by the hope that you provide. And there are folks, you all know them, who say, out of tragedy becomes some way to make things better. And so I really want to say thank you for that, because we do need to improve outcomes for people all across our state. That's why I think it's so important today that we are here to talk about some pieces of legislation passed in this year's legislative session that do mark progress toward building a behavioral health continuum, a continuum of care that incorporates harm reduction, suicide prevention, stronger tools against substance abuse among our young people and our adults, and improvements to the implementation of Measure 110. So I'm going to run through these bills, and then I'm going to have a couple of our legislative key allies speak to these bills and other issues we discussed this session. So one of the bills we're signing today is House Bill 2757, which is the 988 Suicide and Crisis Lifeline. Through that bill, we are providing ongoing funding for 988, which is the lifeline that provides free and confidential support to people in suicidal crisis or in emotional distress. Anyone in Oregon can call or text or chat 988 24 hours a day, 7 days a week, to speak with a trained crisis counselor, and if appropriate, get connected to resources in the community. I'm very proud of this bill. Particularly want to thank Representative Tana Sanchez, who is not here today, for her work on this bill to really provide a strong foundation for 988 going forward. Next two bills, House Bill 2395 and House Bill 1043, both focus on preventing overdoses and fatalities. Because whether there is opioid drug use happening at a school or when you have just come out of treatment, we want to make sure that you, as Oregonians, have more access to the short-acting opioid overdose reversal medications that can keep people alive. And I want to thank everyone who's worked on those bills. There's more things in those bills, but the goal is to help people be healthy and stay alive. House Bill 3610 is another bill that takes on the long-term issues we have here. And this is a broader discussion about alcohol addiction and prevention. House Bill 3610 creates a task force to study all types of elements of this issue, from the resources that we currently have to the cost and the workload to the state to deal with this crisis in alcohol use, talking about alcohol pricing in response to how excessive drinking in Oregon is affecting us, because excessive drinking in Oregon is the third leading cause of preventable death in Oregon. Alcohol use is the third leading cause of preventable death in Oregon. House Bill 2513 gets us to the conversation on Measure 110. This bill, and Representative Nose will probably catch us up on this, just a smidge. Lots of work to say, voters passed Measure 110, how do we make it function better for making sure people have the support they need in the community? And so that bill is going to help us more effectively and efficiently use those resources to serve Oregonians. And finally, Senate Bill 238. which will give educators the tools to inform students of the dangers of drug use in response to the rising prevalence of fentanyl use among Oregon's youth. I want to note that I am honored to be here today with Beaverton parents John and Jennifer Epstein. Thank you. Just want you to know that I appreciate your work as fierce advocates on behalf of your son, Cal. I am sorry for your loss, and your advocacy is important. I had a chance to reacquaint myself with the Song for Charlie website that I know you've been involved in. To our young people out there, one pill can kill. You need to know the dangers and take care of yourselves. So I really appreciate the advocacy behind Senate Bill 238. I think it's going to save lives of our young Oregonians. As I said at the beginning, I am grateful for the folks who are in this room because they have worked so hard to make change this session to keep Oregonians healthy and safe. I did mention Representative Sanchez, who couldn't be here, but her advocacy across a number of bills, particularly 988, was impressive. So I'm really glad that we're able to celebrate, even if she's not here today. And also want to thank Representative Maxine Dexter, who was such a proponent of House Bill 2395. Just wonderful work in the session. I know she couldn't be here today as well. So we have wonderful allies in the legislature working on these issues. I just want everyone to know that I am eager to press forward on effective implementation of these bills. It's not enough to pass legislation. It's not enough to have resources allocated. You have to make sure they work. So that's what we're focusing on. We have a long way to go to achieve the vision for Oregonians who need help. Will get it wherever they need it, wherever they can, whenever they need it. And we have work to do there, but this is really good progress. And so with that, I'm very pleased to have with us today our chairs of the Senate and House Healthcare Committees. And so I want to see who we're starting off with. Do we start off with the Senate? Senator Patterson, welcome to the dais, Senator.
Well, I certainly want to thank Governor Kotek and my colleagues here for the work on this critical issue. And Governor Kotek, to you, thank you for making this such a strong priority of your administration. And thank you to all of you who've been working on this issue so hard. I see many folks I know here who've been working on this as a life's work for many decades. I'm not looking at your gray hair, Tim. Thank you to all of you for the work that you're doing on this. And my heart also as retired clergy goes out to the families who are struggling with loved ones who this issue is devastating. And to those who've lost loved ones, my heart goes out to you. But hearts going out and prayers and thoughts aren't enough, are they? Which is why I am working in public policy. We have to change public policy to make things change in the world. So it needs to be said that there is a behavioral health and addiction emergency in this country. We all know that. That's why you're here. That's why you're doing what you're doing. Our communities are nationwide, not just in Oregon, are grappling with spikes in drug-induced overdose deaths and behavioral health challenges. And Oregon is no exception. Data from the Oregon Health Authority shows deaths from opioid overdose have risen dramatically in Oregon from 228 deaths, which is 280 too many in 2019, to over 900 overdose deaths in 2022. This crisis demands an immediate, impactful response to protect public health and safety and to prevent even one more unnecessary death. In the 2023 legislation session, we took action, passing bills that will get people the help they need now. And I'm very pleased that we're here today so that our governor can sign these solutions into law. I'm particularly excited about several life-saving bills that will increase access to overdose reversal medication, as Governor Kotek has mentioned, including Senate Bill 1043 and House Bill 2395, which she talked about earlier. They will save lives. These bills are critical for saving the lives of Oregonians, and I'm so grateful to Governor Kotek, Representative Maxine Dexter, Representative Tina Sanchez, Representative Rob Nose, and others, and to you for your leadership and advocacy in helping get these bills to pass. Thank you. And I'm going to introduce Representative Nose.
Good afternoon. For those of you that don't know who I am, I represent House District 42, which is inner southeast and a little sliver of northeast Portland. And I'm the chair of the House Behavioral Health and Healthcare Committee. And I'm proud to be here today to recognize the important work we got done to strengthen the behavioral health and addiction services that we have across the state. This session, we built off the work that we started back in 2021. And Governor, you probably don't remember this, but you said to me, I feel like maybe in December of 2020. No, I'm pretty sure you used my last name. I'm making you the vice chair of the Behavioral Health Committee, and I'm expecting you to work as the Ways and Means sub-chair and get everything that Sanchez passes in her committee funded. And here we are. Okay, 2021 and 2022 were historic sessions for behavioral health. And during the 2023 session, we maintained those investments and we continued our work to increase care and treatment. What we accomplished is going to help stand up more residential and substance use disorder treatment options, hopefully stabilize our hospitals, and fund more community programs. Now, I'm just going to take a moment to mention a few of the bills that we've already discussed. First, as has been mentioned, the opioid harm reduction package, House Bill 2395. Its chief sponsor was my colleague, Representative Maxine Dexter, who, as you heard, couldn't be here today. This bill is making life-saving emergency treatments like naloxone more available in public buildings, including restaurants, grocery stores, police departments, and schools. As you all know, naloxone can restore breathing and reverse an overdose by rapidly blocking the effects of opioids. House Bill 2757 is going to make sure that 988, the suicide and prevention hotline, is stable and has the funding it needs to be operating across our state 24/7. One of the chief sponsors of the bill, Representative Tina Sanchez, has said that answering the phone and talking someone down before they end up in the emergency room or jail is going to be one of the most effective approaches to solving the crisis that we're in before anything gets worse. And I couldn't agree more. We have data that shows that she's correct, okay? In Oregon, 988 resolves or de-escalates nearly 97% of the calls that come over the phone. And lastly, I'd like to take a moment to talk about the Hope and Recovery Bill, House Bill 2513. It's a bill that I'm very intimately involved with, a strong bipartisan piece of legislation that improves what voters adopted when they adopted ballot measure 110. This bill is putting us on a path to help us deal with addiction and get people connected to the services they need to begin to get on a path to recovery. Now, I know better than most that this measure pretty recently has seen some pushback. But I want to encourage everyone here to look at what the data is beginning to show us and give this measure a chance and the time that it needs. We are only less than a year in its actual implementation. And we have given the war on drugs over half a century, and we know that that has not worked. This needs to be given time. And we owe it to Oregon voters to give it a try and allow it to work. And I'm not going to just ask you to take my word for it, okay? According to the Oregon Health Authority, second quarter report, Measure 110 substance use treatment services have grown by 44% in the first 6 months of its full funding. This is money that's used for recovery housing, detox centers, and other critical treatments and services programs open regularly. People in recovery who were provided housing services, that increased by more than 125%, and those provided employment services, that increased by 136%. The bill that the governor is going to sign today is going to make sure that we stay on track and make the critical fixes in that measure so that outreach is more effective and efficient across our state. Just like all the efforts we're making on housing and education, we know that there is still a lot of work to do in the interim and in 2024. I look forward to continuing to work with all of you. Governor, I want to thank you, and I want to thank your wife, Amy, for your commitment to improving behavioral health and addiction services across every corner of the state. I'm really looking forward to working with your new behavioral health advisor, Julia Wallace. Okay? All right, that's enough.
Thank you, Representative. So we'll do the bill signings now, and then for members of the press, I will take a few questions after we do the bill signing. So I think you should all come up here, unless you want, if you're looking, I will say the bill out loud, but everyone is welcome to be on all of this. So come on up. Yeah, 238 is first. 238 is first.
Some of you should get right next. I get to stand next to her a lot. Yes. Yeah.
Okay, this one I'm gonna get right in the front for.
Yeah.
This one I worked on. Oh, yeah.
Come on, Dwight.
This one's all right.
Don't ask me to remember the numbers.
I didn't get a chance. We have some other legislators with us today. We have Representative Graber with us, so great to see you. I saw the Senate President Wagner is here. We have with us Multnomah County DA Mike Schmidt. Nice to see you, Mr. DA. Am I missing anyone? And oh, and Representative Bynum. Good to see you. So, questions, Lisa?
We are really back off on plan. You support
I think we need to understand the legal parameters for restricting people using drugs on the street. We have that with alcohol. We don't have it with other drugs. I do think the mayor got out a little ahead of himself. And I do know legislators are starting to take up that conversation.
Would you support it?
I think what Measure 110 says is we did not, I don't think any of us want to see drug use on the streets. And so I think we need to do something about it. I'm not sure what it is, but we need to do something about it. So, yeah. It's a great question. So even before I was sworn into office, we had lots of conversation with Oregonians about Measure 110. And we now have an audit that I think there will be a series of audits, but the audit recommendations in particular about better data reporting, more accountability on how the dollars are being spent is something I'm very committed to, and it's something that I've directed both Director Baden at Oregon Health Authority, but also Ebony Clark to really focus on. I think voters wanted to see resources being used effectively. So that is what's so important about House Bill 2513, because I think it clarifies some of the vagueness that was in Measure 110 to clarify who has what role. And I think that's going to provide stronger data, stronger oversight, and as a result, I think stronger outcomes for Oregonians. And I will say right now that the Measure 110 dollars are working. I mean, Representative Nose talked about some of the numbers. We know that there'll be some new detox beds standing up here in another week or two from the Measure 110 effort. So I, want to just emphasize what Representative Nose says. Things are beginning to work, and my job as governor is to make sure that we are effective with the dollars that voters wanted to see go to recovery.
So we did comment on the report. I had a question about personnel in your office. Annalise Dahl can move to the commission, the alcohol and drug commission. You're going to hire Juliana Wallace as the behavioral health initiative director. What kind of instructions are you giving them? What are you telling them to go do?
Well, and Director Dolph is right behind you. So really good question. So one of the things that really became apparent, 6 months into the job is all these conversations about alcohol and drug services as well as policy needed better coordination. And that is what the Alcohol and Drug Policy Commission was set up to do. And when I started, we didn't have a director. We had an interim director who had stepped up. So I was very pleased to have Annalise go from my office over to the Alcohol and Drug Policy Commission to focus on that commission, what its role is, get some new members on the commission, make sure that we have coordinated policy across statewide government to serve folks who are dealing with an alcohol and drug issue. And we will be talking with the commission about what those next steps are, but we have to see greater coordination across all state services on that particular topic. And because Annalise was my behavioral health initiative director, we had a vacancy. So we are very excited about Juliana Wallace coming from Central City Concern to join our office, focusing particularly on initially at the intersection between folks with serious mental illness and homelessness, working with the First Lady. We have a lot of work to do there, and we are in the process of getting some providers together to talk about what do we need to do better with the resources we have to serve individuals who are very ill living on the streets, and we're going to do that.
I have a remote question from Dick Hughes. With the legislation that has been signed today, what are the challenges going forward in getting more Oregonians into the behavioral health and/or substance abuse treatment that they need?
Well, I think all the challenges are related to capacity, right? We need additional residential capacity, inpatient and outpatient care. We are challenged by a workforce crisis where individuals who have been committed to this field, we don't have enough of them, and then we have folks who for a lot of good reasons, have decided to get out of the field. We need to bring them back. We need to retain workers. So I think our biggest issue is standing up new capacity, finding the resource to do it, but then having the workforce to provide the care. So I think those are the biggest challenges for implementing what we know are significant new investments and tools to help Oregonians. It's up to us to make sure it works in every community. Oh,
Secretary of State has indicated that he does have a full measure of was she in consultation during this process, first part, and then secondly, the Republican senators have already indicated challenge that. If, assuming the court accepts that, that will be two different ballot measures. Or do you think that there needs to be some measure to look at the constitutionality of these ballot measures before they?
well, I think in the issue of Measure 113, I think it's clear what the voters intended. When people don't show up for work, that they will be held accountable. I did not consult with the Secretary of State on her decision today, and I think ultimately this will be decided by the courts. That is not unusual. Measures do get challenged from time to time, and I think her ruling is in line what was the intent of the voters in the passage of that measure.
Yeah, Governor. So I was just wanted to get your thoughts on just was there any unfinished work from the session across the finish line? Looking at this for the next session.
In which area? Look, here's the deal. There's always unfinished business. Every legislator and anybody who works in government always knows you don't get 100% right. There's always more work to do. In the area of behavioral health, I will say one of the things I need to partner with the legislature on as we go into next session is the state hospital. The Oregon State Hospital is a 24/7 facility. We are making great strides to figure out how we can manage the population of folks coming in and out. We must support the workforce differently at the Oregon State Hospital. They need to be funded for a 24/7 staffing model that allows them to do their work, but also be in a workplace that supports them. And that is an ongoing conversation with the legislature. If I can think of one thing that we didn't get all the way finished in the session, it was really having agreement on how we staff and fund the state hospital to do their best work. Mm-hmm. I support harm reduction. I think we need to understand which safe consumption sites would be most effective. I did not support what the county was doing around straws and foil. I don't think that was the right next step. We do have resources under the opioid settlement to help promote harm reduction in communities. And actually, as I've been traveling around the state and talking with different providers in different counties, it's been pretty impressive, the type of on-the-ground harm reduction work that is happening. I want to support that. We may have to make sure people don't die, and we have to make sure they can get into care. And I think that is part of the continuum, and I do support that if we're doing something that shows actually works. Yep.
Governor, do you have any concerns about how Oregon is supporting the organizations and utilizing the prophecy, putting four prophecies together?
Well, I know you've been covering this issue, and I'm actually looking forward to a conversation here shortly with the leadership of all of our coordinated care organizations. There are some growing level of reserves. And so what I would like to have them engage with me on is how do we use some of those dollars to improve access to behavioral health care for Oregonians who are on the Oregon Health Plan? We know from the recent report from the Oregon Health Plan Ombuds Office that we don't have capacity. There is not enough access points, particularly for substance use disorder treatment. So that is the conversation I'm going to be having with the CCO leadership. Look, you do good things, and if you have resources, we need to have more SUD treatment capacity around the state. So we'll be having that conversation. Wow, you're just a very enthusiastic bunch. I love it. Go ahead.
Were you disappointed to see that the measures that address substance abuse for minors taken out of the one bill, and then do you think it was worth it to add in tax for the hotline?
Well, I do know that there was bipartisan support at the end of the day for the funding for the 9 and 8 line. I'm really glad we got that done. I think it got kind of caught up in the final end of session conversations, but I think it was because people wanted to make sure it got done, and it did. As it relates to 2395, I did have a conversation with Representative Dexter about some of the end of session negotiations. She felt very comfortable about some of the compromises that were made, still a very effective bill. And so I was glad to hear that from her. What I want to make sure under that bill is that our school districts in particular feel comfortable and have the education they need to make sure that opioid overdose reversal drugs are available when students look. We don't want to think about young people having an overdose in a school, but I want to make sure that that child, if that happens, that they are alive. So hopefully our schools will get what they need. And if they don't, we might have to go back on that conversation.
Sports rental, substance use for children under 14.
I think it's important that every child in the state get the health care they need. And I think under that bill, I think there were good guidelines about how that would happen. My job now is to make sure there's plenty of capacity so when a child does need that help, they can get it. And right now, we are not quite there in the state. Thank you all. I really appreciate the time today. Thank you.